Welcome to the Doctors Hospital Distinguished Lecture Series. Every month we invite members of our medical community to speak on topics that matter to you, the Bahamian public. We trust that you will find this information useful. Now sit back, listen, and learn. Isn't your health worth it?
Good evening, everybody. I am delighted to have this opportunity to bring to you this lecture on current treatments and new advances in glaucoma care. So I heard she got the question that I was just about to ask you, what really is glaucoma? Well, really, it's a group of eye diseases which all have in common a characteristic particular feature: progressive optic nerve damage. The optic nerve is the nerve that connects the eye to the brain. When that nerve gets damaged, that begins to affect our side vision. In other words, if you're walking straight ahead or driving straight ahead, do you have the ability to see a big truck coming from the side so that you could protect yourself without actually having to look to the side? Glaucoma is a leading cause of blindness and vision loss all around the world. Yes, this blindness is irreversible, but it is also preventable. In our world of 7 billion people, over 60 million have glaucoma. It is estimated by the year 2020 that number will increase by some 10 million. The diagram here is really showing us the basic anatomy and parts of the eye. So the front here is the cornea. That's the part that you and I are looking through. It's the window of the eye. This part here is called the lens. This is the part that bends the light so that we could see. It is also the same part that gets cloudy as we age and forms a cataract. And that's when I would do cataract surgery. Everybody knows about cataracts, right? Yeah. Then at the back here is the retina. That's the part of the eye that may be affected when people have long-standing diabetes. Now the final part here is the optic nerve, and that is the site that gets damaged with glaucoma. Of the 3 million people affected with glaucoma in the United States, only 50% of them, that's only half of them, actually are aware of it. What that means to you and me is that there are about 1.5 million people in the US walking around, getting along with their daily lives, and they're not receiving treatment. They don't even know they have glaucoma. That sounds pretty detrimental, doesn't it? Yeah. Glaucoma has the ability to be a silent thief of sight because it is often asymptomatic. That's why people could walk around and not know. In fact, up to 40% of an individual's vision could be lost without the person even noticing it. 40% is a pretty big number. Yeah. Herein lies the importance of regular eye examinations, whether it be every year or every 2 years, whatever it is that your eye care professional recommends, because he or she is tailoring your management specific to your eye and to your needs. In the Bahamas, we are currently building our statistics on glaucoma. A review of the data from the Aaron H. Gilmore School for the Blind and Visually Impaired showed us that 12% of their 69 students have glaucoma. We did a public glaucoma screening campaign in 2017 of 130 individuals right here in Nassau. In that group of 130 people, we yielded a diagnosis of glaucoma in 11% of people. Another 22% you see here was also found to be glaucoma suspects and referred for further testing and evaluation. So why is this important? Why do you take the time on a Thursday afternoon to come and hear about glaucoma? Well, because glaucoma is an eye condition that has the ability to affect our overall quality of life. Even with adequate treatment, 15 to 20%, that's like saying 1 in 5 individuals to 1 in 7 individuals with glaucoma has the ability to go blind in at least one eye over a 20-year period. By the year 2020, it is estimated that about 6 million people will be blind worldwide in both eyes from glaucoma. 6 million is a big number. That's 6 million people that each country has to care for. Yeah? With our aging population, it is likely that patients with glaucoma are at greater risk for visual impairment and all the associated socioeconomic issues that come with that, inclusive cost of medications, the cost of caring for the visually impaired, loss of productivity at work, disability, accidental injury, and so on and so on. The burden of which is not only carried by the patient, but also carried by family members and wider community. But there is hope. Early detection is key. Blindness and vision loss from glaucoma can be prevented. Indeed, this does require collaboration from all stakeholders: primary care physicians, specialists, all eye care professionals, nurses, pharmaceutical companies, community activists, most importantly, you. This logo here, Beat Invisible Glaucoma, is the international logo of World Glaucoma Week, which we celebrated in March 2018, all around the world, including right here in the Bahamas. If we are going to identify the people who have glaucoma, we have to know who is at greatest risk. Big risk factors are age. Anybody over the age of 40 should be screened. Age over 60 increases someone's risk as much as 6 to 8 times. Positive family history increases one's risk as much as 10 times. Black people are at an increased risk by as much as 6 to 8 times. And sometimes they have glaucoma that's a little bit more hard or difficult to manage. Hispanics are also at an increased risk. Elevated eye pressure is a significant risk factor for glaucoma. For your information, the normal eye pressure for a healthy eye is under 21 millimeters of mercury. Other risk factors: trauma to the eye, diabetes, a thin cornea. Remember we showed you the cornea at the beginning. That's that tissue at the front that we look through. We find that if that is a little bit thin, sometimes that increases an individual's risk of developing glaucoma. You see a picture there of a patient having their corneal thickness being evaluated, right up there. Other risk factors: steroid use, nearsightedness, which is the ability to see up close fairly well, but someone having a challenge seeing in the distance, like down the road. Regardless of the type of glaucoma, whether it be open angle glaucoma or angle closure glaucoma, steroid-induced glaucoma, traumatic glaucoma, congenital glaucoma in babies, when the pressure inside the eye is too high, what does it do? Causes damage right there to the optic nerve. And this results in damage to specialized nerve cells, which we call retinal ganglion cells. These are nerve cells we do not today have the ability to regrow or regenerate. Herein lies the problem of glaucoma. So how do we diagnose glaucoma? first thing we're going to do is check your vision. Is that true? Yep. The next thing we're going to do is measure your eye pressure. So you see this lady having her eye pressure being measured. The next thing, a dilated retinal exam, where we put some drops in the eye, dilate the pupil so we could look on the inside of the eye. Then we look at the drainage system of the eye. We look at the pathway where the fluid inside the eye travels to make sure it's healthy and that there's no obstruction. Then we take pictures of what the eye looks like from on the inside. So this picture here is showing you what the head of your optic nerve looks like. And this is exactly what we're looking at and measuring when we're examining the inside of your eyes. And this is also a picture of somebody having very advanced glaucoma. Then we do testing of your side vision. We look to see how much of your side vision is affected, and we do that with visual fields. And this is an example of what the report of a visual field would look like. And in fact, this visual field is consistent with this optic nerve change here, showing advanced glaucoma. So what's new? First thing is optical coherence tomography, OCT. This is a non-invasive diagnostic tool that has really become essential in diagnosing and monitoring glaucoma. It has the ability to show us thinning of the nerve of the tissue around the optic nerve, which would suggest damage from glaucoma. It helps us to detect glaucomatous changes up to 6 years before our traditional visual fields. This here is a picture of what the OCT would look like, and this is what the report looks like. A new application of OCT is called OCT angiography. This is a test that actually helps us to trace the blood vessels that supply the optic nerve, that bring it its nutrients, its food, its oxygen. So for example, if you look here, these are the blood vessels supplying this area called the optic nerve. When you look over here, those blood vessels don't look so juicy and fat, right? So right in that area there, there's actually a defect in those blood vessels. So we're able to detect that. And that application is evolving even as we speak. Here is what we call a home tonometer. This is a device that an individual could use at home all by themselves without any assistance to measure the pressure in the eye. And you see that's a patient doing it all by himself. The value of this is that we have come to find that there are increases in eye pressure that may occur in patients at the times when we will never see you. Office hours are 9 to 5. Some people have increases in their eye pressure 10 o'clock at night. We'll never know it, and if we don't know it, we can't treat it. So this device has the ability to store that data in it. When you come into the office, then we can address it. The next test here is a smart contact lens. Everybody has a smartphone and a smart TV. So this is a smart contact lens. And it's doing the same job. This job actually is used to monitor the changes in the shape of the eye throughout a 24-hour period, and that correlates with changes in the pressure in the eye, helping us to get valuable information about what your eye pressure is doing in the times when we don't see you. So the mainstay of treatment for glaucoma today is to reduce the eye pressure. How do we achieve that? Medications, which may either decrease the production of the fluid in the eye, or medications that will increase the drainage of the fluid from the eye, or a combination of both. And you see here pictures of some of our common glaucoma medication that we would use. Alternative options would be laser treatment or incisional glaucoma surgery, right here. We do have some new medications on the market. One is called Visulta, which is a routine prostaglandin but it's also a combination with something that hasn't been included in glaucoma drops in the past, something called nitric oxide. And they have found that this medication has helped to lower eye pressure by as much as 9 points, 9 millimeters of mercury. Another medication that's new is called Ropressa. This particular medication is the newest of all the glaucoma class of medications that have been produced and approved by the US FDA in a period of 20 years. It means for the last 20 years, no new class of medications have come forward. And this one actually targets some enzymes and their activity inside the eye. Of course, there are always newer medications that are still coming forward. They are currently in clinical trials. So what's in the pipeline? First thing, we know compliance is always an issue. 50% of the patients who take glaucoma medications are unable to be compliant with their medication more than 75% of the time. So we are constantly trying to improvise new ways to get the medication to patients in a safe, effective, and convenient manner. So we use, for example, sustained release implants, like that. See that there? That's actually a device that's sitting on the inside of the eye, and it has the ability to emit the medication, like a glaucoma drop. It's emitting it slowly in a sustained release fashion over a 6-month period. Thereby, you don't have to remember to put that drop every day, not that particular one. Another new device that's coming forth are preservative-free silicone ring inserts. And so this is what this looks like. So you see it being inserted around the eye. And again, it contains preservative-free versions of that eye drop and will slowly be emitted over a 6-month period. These devices are currently undergoing their trials to determine and confirm safety and efficacy. So laser trabeculoplasty is one of our laser options for glaucoma, and we use it for open angle glaucoma. So this is what the device would look like, and you see a patient here receiving her laser therapy, and this is where it would be applied. So if you look up here, this is the pupil of the eye. This is the colored part of the eye. In some people, it may be blue or green, right? So for us, it's brown here. And here is where this laser is being applied, onto the wall or the side of the eye. And that's what it's showing you there. This is not a new procedure. We've had laser trabeculoplasty around for quite some time. But the technology of the laser is what has been evolving over the years. So in the past, we've had ALT. We have SLT now, and the newest thing, which came out in about 2016, 2017, is MLT, micropulse laser trabeculoplasty. And all of this is trying to do is find a way to lower your eye pressure by increasing the outflow of the fluid from the eye. An alternative laser for some people would be laser iridotomy, and that is specifically for angle closure glaucoma, or people that may be at risk for angle closure glaucoma attacks. So here again, you see a picture of the eye, and you see this cloudiness behind the pupil. Everyone sees that? Anyone knows what it is? It's oh, excellent, excellent. That's a cataract, very good. So just above that, you see this area here. This is what a laser iridotomy looks like. We've simply created an opening right there to allow the fluid to find its way outside of the eye. Because it means in these patients who have angle closure or narrow angles, their drainage system is just too narrow. Fluid cannot make its way through. An alternative option for some patients, if they have visually significant cataracts, simply take out the cataract surgery. And that's the newest thing today. If it's appropriate, that is an option that we can offer you. Laser cyclophotocoagulation. Okay, so again, this is not a new laser procedure. This here is what the laser apparatus would look like. This here is us looking on the inside of the eye. And this is a laser that's really intended to be applied to the parts of the eye that produce the fluid. something we call ciliary processes. So here you see it. In this particular setting, this probe of the laser is inside the eye and it's being applied to those ciliary processes. There are times when we do this same procedure, but we do it to the outside. And this is what it will look like afterwards. So these are the ciliary processes. They're nice and swollen and white. And over about a 6 to 8 week period, slowly they will decrease in their activity and their production of fluid will go down and down and down. This is a procedure that was in the past really used for end-stage glaucoma, poor visual prognosis. Today, we have changed that. It's not only reserved for those patients, and we can offer it to other patients. And in fact, today, we often learn now to combine it with cataract surgery, which is often what we do today, combine cataract and glaucoma surgery when it is appropriate. For anyone that has had cataract surgery, you know we have put in a lens after we take the cataract out. So this here is showing you what that lens looks like. See right there? That's what a lens looks like. So that's what you would be looking through. Okay? Now, incisional surgery may be needed if we are unable to achieve the kind of pressure reduction that we want in all those other previous options. The gold standard for incisional glaucoma surgery is trabeculectomy. That's a fancy word to say we create a filter so the fluid in the eye has an alternative way to get out. It does not come out to the outside world. On the ball of the eye, there's a layer of tissue covering that area. And so if you look here, this is called a bleb, and that is exactly the place where the fluid is draining through. This here is a tube. So we put tubes and shunts and stents inside the eye, all intended again to drain the fluid out. So this is a picture of what one would look like. The tip of the tube you see here is actually on the inside. And if I show you on a model, that's it there. And on a model here, you see the tip still inside, but this is what the plate, this is what the back of it would look like. You'll never see this because this is all covered neatly underneath the tissues of the eye. Now, we're constantly trying to modify and find smaller devices that are still safe and effective and associated with as least amount of risk as possible. And these include minimally invasive glaucoma surgical devices. There are dozens upon dozens of these. So it means that they're still tweaking them, right? Some common ones, Zen implant, iStent Supra, which is out of Canada, in Toronto, where I just completed my glaucoma fellowship, canaloplasty, trabectomy. As I say, this one here is the iStent, and as I say, there are more. I've only given you some of the more common ones. There are others. Here is a picture of myself with my senior colleagues in South Africa where I did ophthalmology residency. And this here is the instrument called the trabectomy. And this instrument was being introduced in 2010 to the Southern Hemisphere. And the place where they brought it happened to be where I was, Pretoria, South Africa. And they happened to bring it at the hospital where I was working. So this is what the instrument would look like. Now, this whole instrument is not what goes inside the eye. All of these devices, they have a probe, like a tip. And it is this probe that's going to go inside the eye and do the job. We did a study of about the first 14 eyes, and we followed them, the first 14 patients who had this procedure, and we followed them over a year. On average, their starting pressures were about 21, and after a year, their pressures were about 19. No significant change in vision in any of the patients. Tips on how patients who have glaucoma can help their own management. First thing, keep your appointments. They are valuable. Second thing, bring someone along with you to your appointments. It's helpful. Sometimes they can remind you of the important questions you need to ask. It's helpful for someone to hear the information and remind you of what you need to do, how to follow the instructions. The next thing, bring your medications. Don't assume, okay, it's easy, the doctor can find it in the notes. Sometimes you happen to meet a new doctor. Anyone ever met a new doctor when they went to their appointment? Yeah. So it's advisable to do that. Ask questions. What is my eye pressure today? Am I using the drops in the correct way? Or show me, doc, nobody ever showed me. Please explain the test results to me. And if you didn't get it, show me again. Be diligent with all your medications as well as the doctor's instructions. If it's kind of hard to remember to put these drops or even to take tablets. If you need help, set a timer. Set a timer on the cell phone or arrange a phone call. Let someone remind you, pick up the phone at lunchtime and call you, it's time to do this. So what is our vision for glaucoma care in the Bahamas? So I'm speaking as the only Bahamian glaucoma specialist locally. So what's our vision? We intend to improve public awareness and education of glaucoma, like this forum here. We want to continue with our glaucoma screening campaigns, like the one I told you about we had in March 2018. We hope to develop a glaucoma support group and hopefully one day build a foundation. We hope to organize a low vision clinic. We don't have one of those today. Why is that important? Sometimes people need to learn how to make a cup of tea. They need to learn how to organize their home so that they could get around. Just because you're visually impaired does not mean you're no longer able to be independent to some extent. Does not mean that you cannot significantly contribute to your community or your society. There's nothing to deter you. You could probably still get to work. You could still have a job and still have a meaningful life, but you need the support to do so. We hope to continue to collect the statistics on glaucoma here and someday build a blindness registry. Thank you for your time.
We hope you've learned a lot from this edition of the Doctors Hospital Distinguished Lecture Series. Please join us in the Loudon Conference Center on Dowsville Street every third Thursday for the monthly health talks, where you can feel free to ask your questions. Isn't your health worth it?